Fat transfers work. It's the oldest filler. It's a natural filler. Of course it works. It's their own genetic material. Of course it works. So given these parameters, that's how I explain it to my patients. And I'm not someone saying, it's a flip of a coin. Well, who the hell wants to do that? That's just ridiculous. So it's easy, for someone who doesn't have the experience doing fat transfers to say an implant is always going to be better. Well, the risk profile of the implant is tenfold worse than a fat transfer.
So it's essentially like a bacterial sort of like just same thing with anytime you open someone up or, you can get an infection. But outside of that, transferring your own fat from one place to another, the quality of the fat's the same. Essentially, you're just moving things around. Opening you up is the danger.
Yeah. And these are super small spots. I mean, yeah. So that's a
Mhm.
that's a
Okay.
basic, thing that face, breast, butt. Okay,
Yeah.
we move fat from one place to another. People ask me all the time about putting fat in their face. And because I already told you, and you can go look at the studies, you're going to gain weight over time, and that's going to get bigger, not smaller. And
You're gonna
so,
need some fat replacement for those buccal fat, removed people that don't look quite the way they wanted to.
right. So that's why we didn't do that. I've never done that
Oh,
procedure
really? Oh, wow.
because you know where that's going to end up.
Yeah,
There's no
right.
reason, and there's a device called Evoke that you wear like a pair of headphones down here that will reduce that fat.
Wow.
And then we have Softwave in the office to tighten skin.
Yeah,
So
I like
the
Softwave. I've done that a few times.
so the underlying theme is always tighten before you fill. That way you don't have to fill as much.
Exactly. Exactly. The face being an interesting thing because there's like, what have I heard? There's like saggers and sinkers, right? The face either slides down or it kind of hollows out. I'm probably like a sinker, I think, or I get a little hollowed out. What are your thoughts on some of those other procedures like the biostimulators like Radiesse and Sculptra? I think there's another one too. Something I can't remember.
They're both so old. They're old as I am.